I was at the book club and I was feeling fine, and then you come home, you get this pain, and your whole world changes. And I told my husband something's really wrong, and so we went to the Queen. I was there 4 hours.
On the surveillance imaging, they found this very large mass.
I couldn't believe it. I've never in my life been so stunned by anything. I thought maybe it was the kidney stone or something.
The surgical option was really the only option for kidney cancer.
Then I had the surgery. I was only there one night. He took it all out. He came in the next morning. He says, "Do you feel 10 pounds lighter?" And I said, "Why?" And he says, "Because that was a really big tumor."
We executed it with the Da Vinci Xi robot. It took about 5 hours or so. What this allows us to do is essentially have tiny human hands inside the body. So these are laparoscopic instruments that are wristed. The dissection that we can do is much more precise. We can work in more difficult to access regions of the body. The intuitive robot that we have here is really the tip of the spear.
I woke up the next day with no pain, and I haven't had any since. It really makes a difference in people's lives. I was just fortunate that he's here and that the Queen had the equipment. He saved my life.
I knew something just felt off. He was hot. He had a fever over 102, which at that age definitely raised a concern, and I just decided I'm just gonna go to the doctor's office and see. She said, "Bring him in, let's take a look and see what's going on here." And his skin was looked like marble, and she said, "You need to go to the ER right now."
He was sent over from the pediatrician quite ill.
When we got there, she brought us to this room that I've been in myself, in my years past and experiences, but this room was different. It had this very small machine.
We had just completed training on this new piece of equipment, which is state-of-the-art resuscitator for newborns and children in the first month of life.
And I would notice this machine pump a breath of oxygen into him when it noticed that he would stop breathing on his own.
He had a bloodstream infection that was affecting his breathing, and he actually stopped breathing on multiple occasions. And this piece of equipment that was purchased with the foundation support really saved his life.
And I asked, about this machine, and she told me that, this just came into operation just a couple hours before you got here. We're just so thankful that it turned out positive.
A year and a half ago, my niece and I were on vacation in Europe. The day after we arrived in Barcelona, I developed the worst headache of my life. It kept getting worse and worse, and so I finally went to a hospital. They did a CT scan while I was in the ER, and it showed a large blood clot in my brain. I was actually having a stroke. They put me in their ICU on a blood thinner drip. I stayed there for 2 weeks and just kept getting worse. So finally, thanks to friends and doctors here at the Queen, I was able to get on a medical flight back to Napa. And they took me in the ambulance and brought me here to the Queen.
And I remember hugging her when she arrived, so grateful that she was here.
And I didn't know that night was going to be the worst night.
It was identified that she had increased intracranial pressure.
And I was taken downstairs to figure out what was going on, get some images of my brain.
I remember getting her to the CT scanner and calling her mom and asking her mom to come in and her best friend.
What I do remember is Michelle White holding my hand. I remember her holding my hand with one hand while she was pushing drugs with the other hand. Drugs that, as a critical care nurse, I know what they mean.
was a very scary night for all of us.
The hospital here is very collaborative. I think the team here is actually very comprehensive. We have a neurosurgery team, a neurology team, and an ICU team, and we work very well together. For this patient, for Jen specifically.
My confidence in Dr. Ho, the neurologist, was complete, and I knew that they would figure out a treatment plan that was going to give me the best chance possible to get back to a meaningful life.
And I am so grateful that we were able to provide her with such incredible care that she continues to work side by side with us today.
I know that I would not be here without Queen of the Valley.